The axillary lymph nodes. The axilla, armpit, contains 20 to 40 lymph nodes, arranged into 5 named groups based on their anatomical position. Together, they drain lymph from the breast, chest wall, upper abdominal wall above the umbilicus, and the entire arm. This wide drainage territory is exactly why axillary lymphadenopathy has such a broad differentials like breast pathology, arm infections, chest wall lesions, and even upper abdominal sources can all present here. There are 5 groups of axillary lymph nodes in the axilla. Anterior, pectoral, group. Posterior, subscapular, group. Lateral, humeral or brachial, group. Central group. And apical, subclavicular or terminal, group. There is a simple way to remember the logic. As the 4 groups sit around the walls of the axilla. These are anterior, posterior, lateral, plus the central group in the middle. And everything ultimately funnels upward into the apical group at the top, which acts as the final common exit point. Let's discuss these groups in details. The anterior, pectoral, group. It is located along the inferior border of pectoralis minor muscle, near the lateral thoracic vessels. The number of nodes are roughly 4 to 5. It receives lymph from the breast, skin, and muscles of the upper anterolateral body wall. This is the group that receives the major portion of breast lymphatic drainage. It drains into the central and apical groups of lymph nodes. These lymph nodes receive the major portion of the lymph draining from the breast. This is the single most clinically important fact on this slide. In breast cancer staging, this pectoral group is the one most relevant to sentinel lymph node biopsy and axillary clearance discussions, since it's the first-line drainage station for most breast tumors. The posterior, subscapular, group. It is located along the posterior wall of the axilla, along the inferior border of subscapularis muscle. The number of nodes are roughly 6 to 7. It receives lymph from the scapular region and the posterior thoracic wall, thus draining the back, as far inferior as the superior border of the iliac crests. It drains into the central and apical groups. The drainage territory extending down to the iliac crest region often surprises students, as it's a good teaching point that lymphatic drainage doesn't respect the local area only assumption people default to. And it's part of why a posterior back lesion far below the shoulder can still ultimately present as axillary lymphadenopathy. The lateral, humeral or brachial group. It is located along the lateral wall of the axilla. It receives lymph from the arm. This is the main drainage pathway for the entire upper limb. Then it drains into the central, apical, and deep cervical nodes. This group receives lymph from the arm and drains into the central, apical, and deep cervical nodes. Worth noting the deep cervical drainage route specifically, since it's the reason a significant arm infection or lesion can occasionally present with neck node involvement, not just axillary nodes. The central group. It is located at the basal center of the axilla, embedded in the axillary fat. The number of nodes are roughly 3 to 4, but larger than the other groups. It receives lymph from the anterior, posterior, and lateral groups combined. So this is the key convergence point. Then it drains into the apical group of lymph nodes. These are usually the largest and most easily palpable nodes on clinical examination of the axilla precisely because they're the convergence point for 3 separate drainage streams. This is exactly why the central group is typically what you're feeling first on a routine axillary lymph node exam, before you go hunting for the less prominent anterior, posterior, and lateral groups individually. The last group of lymph nodes is the apical, also known as the subclavicular or the terminal group. It is located deep at the very apex of the axilla, at the lateral border of the first rib, medial to the axillary vein. The number of nodes are roughly 6 to 12. This is the largest node count of any group. It receives lymph from all the other axillary groups. It is the final common pathway. Then, it drains into the subclavian lymphatic trunk. which then continues toward the venous system, right lymphatic duct on the right side, and thoracic duct on the left. The apical nodes are the final common pathway for all of the axillary lymph nodes. This makes apical node involvement clinically significant as a marker of more advanced disease spread. Since by the time apical nodes are involved, disease has effectively already passed through the other groups first. This is exactly why apical or level 3 involvement carries more prognostic weight in breast cancer staging than level 1 involvement alone. Let's see the surgical leveled system. This is an alternative classification of axillary lymph nodes that you'll see in breast surgery. Surgeons often use a different classification based on position of lymph nodes relative to the pectoralis minor muscle, rather than the 5 anatomical groups above. There are 3 levels in this system. Level 1, the low axillary nodes. These are nodes lying below or lateral to pectoralis minor muscle. It includes the anterior and posterior groups of axillary lymph nodes. Level 2, the mid-axillary nodes. These are nodes lying directly beneath pectoralis minor. It includes the central group of lymph nodes. Level 3, the apical nodes. These are nodes lying above or medial to pectoralis minor. It corresponds to the apical group of lymph nodes. This is the classification system you'll actually encounter constantly in breast cancer surgical notes and staging reports. Finally, this is the drainage flow summary of axillary lymph nodes. The big picture. This flow diagram converts 5 separate names into one simple, logical picture. 3 peripheral groups feed into one central group, which feeds into one final apical group, which then exits the axilla entirely.